there in the dark corner, coming here in the front. The last 2, 3 benches, please come in front. Yes, please come here in the front. I am not saying at the same level here, I am saying in the front level here. Why do we shy away from fame, from being the first one, to be the best one, to be the most visible one? Why not? Come in front. Oh, udhar piche nahi jaiye, idhar aa jaiye. So we have, we are continuing with our class on identification. And identification, last time we considered a few scenarios that we have a person who is in a disaster, dead in a disaster, or just in an accident, or somebody comes to is brought to the hospital and is being treated, but nobody with him, and there are no documents on him. So it's an unidentified person. We don't know who it is, whether it is Shah Rukh Khan or Saif Ali Khan, right? We don't know who it is, who has just come in. So if we don't know who the person is, what do we look at? So we look at, is this a male? Is this 45 years? Is it 65 years? Is it 5 feet 10 inches? If it is, let's take the fingerprints. So we try and put an identity to that person, right? So our most important identity features become identifying the age of a person and the sex of the person. Once we identify whether that sex is a binary, if there are 2 sexes, if we say it is female, we have brought the identification where we have removed half the population. Okay, it is somebody who is a female. And if we have age, then we have again reduced it down. So you kind of reduce down to how specific can you get about a person. Whether this person had a leg deformity, it's a personal identification of a certain type. So we can do identification like that. Normally we identify each other, we said. Tapesh, usko Raja ko bolna fan chala de, at least for me. So normally we identify each other by looking at each other, looking at faces, looking at, sometimes when we have not looked at the face, we have looked at how a person walks, we look at how a person, how tall they are, or how they keep their hair, or what do they carry. So we have our own identity features normally in our routine life. We identify each other, often by face, but otherwise by so many other characteristics. Sometimes I can make out that this person was here by a note they left. We said handwriting. So identification is an important aspect of forensic or any medical legal work that we do. So in trauma emergency or in any other setting. So we must brief up that these are the things, and we talked about corpus delicti, that it is otherwise body of offense, but it means what is the main center of a certain crime. We jotted down some points saying these are the factors by which we identify a person. And one of them we picked up last time, and we started talking about how do we identify or look at the teeth, or what do we really look from the teeth, or how do we do age estimation. And then in the age, we were looking at the teeth. So we have all these set of things which help us identify a person. And we brought up some very interesting fact that there are people who are experts who can identify each individual by, and they believe that each individual has a unique gait or a walking style. So we have medical legal importance of age, where we went into when does criminal responsibility come in, when is the age intersecting consent. At what age can a person walk into the OPD and say, I have a bad throat, I have fever, I have broken my leg? So we decided and we discussed and we thought, yes, 12 years is the age by law. Yeah. We become a major at the age of 18 years. That was another important thing that we did. And we moved on to the real wordplay that age is a fact when it is substantiated by a valid document. It's a fact if it is really true and substantiated by a document. So we have, otherwise we do an age estimation, and in the age estimation we normally would look at teeth and bones and physical development of a person. And in teeth we said that this is how we look at, in the lower age group, the eruption of teeth, and how we look at ossification of bones, and in secondary sexual characters. Now it is like a fact that we covered last time, which I'd like to remind you again today before we start. The lower the age of the person, the lesser the age of the person, the more accurate our estimation is, and the higher the age of the person or the more older a person is, the more difficult or to be accurate in the age estimation. So if I am 55, 56, if someone estimates my age, they would always have a bigger range. They would say like this person is between 50 to 60 years of age, and that would be a very good estimate if they can reach that 50 to 60 for a 55-year-old. But for a 13-year-old, we normally can reach to 13 years plus minus 6 months. So that's how we can be very sure about our methods for age estimation. Because we have so many methods which are relatively more accurate, whereas ossification of bones is complete more or less by 21 years of age, eruption of teeth is complete more or less by 21, 25 years of age for estimation of age. And so we can't use these factors, and here we are going to look at bones if it is bones that we got. That means if it was a dead person, or if we got a very good CT scan with a 3D kind of an image of the bone of a person. So the ossification of bones of sternum, or the teeth changes if we could take the tooth out. This Gustafson's method, which is not written very well in your textbook. If you want to apply this method to estimate age of a person, you will need to take the tooth out from the socket or the jaw and then put it through certain process and then come out with the age from Gustafson's method, whatever are the criteria. So you don't normally do it in a living person for the age estimation to take the tooth out and destroy that tooth or put it through a process. You can do it only when you have a dead body where you can take the tooth out. So Gustafson's method looks at changes in teeth, and pubic symphysis is the symphysial surface of our pubic bone, which again can help in later ages. So when the age is, let us say, more than about 20 years, these factors can come into play, whereas at lower age group it's relatively accurate, and you use different methods. And we covered this, that there are two sets of teeth, and temporary and permanent, 20 and 32. And in these 20 teeth in the jaw of a child, in the jaws, both the jaws of the child together are 20 teeth. That means in each jaw 10. That means in each half of each jaw there are 5. So 5 kinds of teeth in each jaw. Whereas we as adults, if we have the complete denture or complete teeth developing in our jaw, we would have 32. That means 16 in each jaw, 32 in all. And this was the diagrammatic representation of tooth. Here I would like you to focus again now on 5 to 6 words that I am going to say. And this is the gum that we have, the jaw, the gums which hold the teeth. So this is the outer part, that is the crown, that means the part of the tooth visible inside our mouth. That's the crown, that's the root. Now this part is the enamel. Enamel is the hardest structure in our body, harder than even bone. So you can kind of have teeth well preserved for a longer time as compared to even bones. So this is enamel. What you should look at is this is dentine here, this brown structure here, dentine, and there is a cementum here, and this is the root canal, and here nerves and blood vessels enter the root canal, and this part is the pulp. Pulp is the relatively softer part inside. So pulp is the central part of the tooth, the part which is deep inside. And changes in all these structures, changes in all these parts take place as we age. As we age, as we use our teeth, as we eat, as we clean, as we don't clean, as we just grow, and as we keep having them in our gums. So there are changes in these teeth which are what Gustafson's method measures. So Gustafson's method just measures the normal aging processes and gives it a certain criteria. So one must remember that whatever criteria one uses for aging, like for teeth, it would vary from you and me. I might be eating the bones of chicken every day, so my teeth will wear out faster, my enamel will get flattened faster than yours. So by what we eat and how we maintain, if I brush my teeth 3 times a day and you brush once in 3 days, right, you will have the degenerative changes of teeth probably faster, like the cementum apposition or secondary dentine deposition, or the transparency of the root of all the criteria is considered still relatively unaffected by personal habits and details. So the most accurate is that is why known as the transparency of the root. And we then did that this is mixed dentition. There are temporary teeth and permanent teeth replace them. They begin to form in the bones while the temporary teeth are there. And that is why we said the roots of temporary teeth are kind of divergent. Divergent means spread apart because they are accommodating the crowns of the next teeth. Whereas our permanent teeth don't have such divergent roots. They have convergent root, which is one of the main differences between temporary and permanent teeth. This is the difference which we use most commonly to look at a tooth and say whether it is temporary or permanent. If we just get a tooth, because of the root which is so divergent or spread out, like this is going in both sides, whereas a permanent tooth would have these 2 roots kind of going together and converging. So the divergence of the root in temporary teeth is because they are accommodating the crowns here. This is another kind of a diagram given when you look in the net about how the teeth are placed and how they are replaced and how temporary teeth do replace. So you have central incisors right in the middle. The most central tooth in our mouth in all the 4 quadrants, these are central incisors in the upper jaw, these are central incisors in the lower jaw, then you have lateral incisor. So these incisor teeth, these 2 are the incisor teeth which are present in temporary dentition as well as permanent dentition. When they fall, when these fall, the temporary teeth, the permanent will come and replace them. So in the central incisor, it will be replaced by central incisor, lateral one will be replaced by lateral incisor. So these 2 are, the names continue at this site. So you always have incisors in the front. This is kind of the front 4 teeth. These are one of the first ones to emerge in the permanent dentition. There is the first molar which erupts, and then these incisors erupts. So you have the eruption of teeth when the temporary teeth are erupting for age estimation, which holds on to when which tooth erupts. So if you open the mouth of a child or in the pediatric departments, looking at the teeth, one has a rough idea that what is the age of this particular child. So you can have an idea about eruption of teeth. Well, good idea or relatively more accurate idea if you are looking at a younger age group. When there are 5 teeth in the, when there are 5 teeth in temporary dentition in each quadrant and 8 in the permanent teeth, right? We had 20 teeth when we were children and we have 32 when we grow up. Now these 20 are replaced by 20 permanent teeth, but the rest of the 12, they are not replacing a temporary tooth. They are coming by themselves. So they are coming beyond the 5 teeth that are there. So it is from here onwards, this molar and another molar which will come later, they are what we call as non-successional teeth. That means they are not succeeding any particular teeth. There is no tooth before them which they are replacing. They are the first teeth. So while we call ourselves diphyodont means we have 2 sets of teeth. We get 2 sets of teeth. Some animals keep getting their teeth. As they keep falling, they keep losing, they keep getting. They are polyphyodonty. We are diphyodonty. We get our teeth only twice. So while we get our teeth twice, any tooth from third molar, from the first molar to second molar to third molar, these do not replace any temporary tooth. So they are non-successional teeth. So while we are looking at these teeth, these temporary teeth have to fall to let the permanent teeth come out. But the 3 will come out as they want to come out because they don't have to wait for anybody to fall and to replace them, right? So when we are looking at teeth, we are looking at eruption of teeth. And while we are looking at the X-rays for eruption of teeth, while we are looking at X-rays, what we call as OPG or orthopentogram, when we are looking at the whole teeth denture, in that we are also looking at the calcification of root. Calcification of root also gives us an idea about the age of a person. This is of course an autopsy photograph where we look at the teeth where because of the rigor mortis, because of the position of the person, it is very difficult to open the jaw and take a complete look. So more often than not, we are unable to see the last molar if it is present. Even if it is present, it's very difficult to see, to kind of open the jaw. While you are having a live person and asking them to open their mouth and show their teeth, you can ask them to open it wider, bigger. But in this, their muscles have become very rigid because of rigor mortis, the stiffening of muscle. It's very difficult to open the mouth. Even if you put your entire strength and try and open this mouth, you may not be able to see right up to the third molar. But what is easily visible is these central incisors. You can look at, and this is a normal procedure that we do at autopsy to turn the lips and see the inner part, because we are also looking for any injuries, we are also looking for any fractures of tooth, any contusions, any wounds which may have formed if it's a case or history of assault or fall. So this is a routine procedure that we do, that we look at the teeth, that we look for any injuries which might be present on the inner side. This part is very prone to injury. A small hit, and because there is this hard enamel behind our lips and our face, so that these teeth provide a very solid background, and whatever may be the force put on over the teeth region, it causes a contusion or laceration very easily. So it's very good place to look for any evidence of fall, assault or injury. There's also the importance of looking at the tongue in autopsy, but that's a different story. So when we look at the teeth, we are able to look in the autopsy like this, and we are able to, in the autopsy what is good is that you can take your time in looking at the tooth, and if you see a line here in this particular tooth, do you see a line here? So if you doubt that whether it is really a line or not, whether it's a fracture or not, you can just keep it open, you can just put your finger, you can just try and feel both the sides, and there are no issues of, whether you can, how long do you keep the mouth open once it is open, how much time do you want to take to examine. Then there are no limits of time and methods. So very often if we open a mouth and we see a fracture, because this could be identity of this person. There could be a line on this could be an identity of the person. The kind of setting of teeth. Again, the people who practice forensic dentistry feel that, and they have done it in crowds like this, like if 50 of us are sitting or 60 of us are sitting, that if you tell what is your peculiarity in your teeth, so each one would have something unique. Each one would have something unique. Although you have a certain set of eruption of teeth, certain type of teeth, but the kind of procedures that we may do, the caries that we may have, the kind of number of cusp or size of tooth that we may have, the fractures we may have sustained. So the denture of each person also is unique. So looking at the denture for identification is very important, and that's what we do. This is again another method where we are looking at it. Of course, this is overstretched for just the photograph, and again when you see here, whether there is a fracture here, irregular surface here, or there is poor oral hygiene or caries, those become identity points. And if they have been to a dentist and have taken some kind of procedures done on them, like this is a wire. So this is a mouth, and this is again in our autopsy room where this particular mirror, which is used by dentists, and when you look at the back side of the teeth, what you can't see from the front, and you possibly may doubt if you were feeling this wire, but in this here it's looking very clear. And because it's a very specialized procedure, if this person was unknown, we would try to trace that person by who does this procedure, where does this person belong to, where did you find the body, and who could have done this procedure, when was it done, and so many things. So you have these personal identification features which may also be there in the teeth. These were very nice ones that we got to know while we were doing a detailed teeth examination in our autopsies along with dentistry department, where a senior resident would come in and note down this as a dental formula. The Gustafson's method that we were talking about for age determination, it has these criteria, 6 of them, and these 6 are written everywhere in every book, that this is what you look at: attrition, periodontosis, dentine deposition, cementum apposition, root resorption, or transparency of the root. And everywhere, like an MCQ, it would be like which of these 6 is the best, and it would be transparency of the root. But why do you say this is the best? Because it is not affected. It is not affected by the routine eating and living habits, like we said. This is attrition is of the enamel, how hard you eat, or if you are in the process of, if you like to eat tobacco chewing, the people, so many in Bhopal are famous for tobacco chewing. So if they are eating betel nuts or doing tobacco chewing, they are going to face the attrition of the enamel faster. So the teeth have these surfaces, 6 surfaces, 4 surfaces on the sides and 1 on the top. So 5th surface, that's occlusal surface. That means the surface which where the 2 teeth come to each other, where they kind of close the mouth. So it's called the occlusal surface. So attrition is the wearing down of the enamel at that occlusal surface. So our teeth normally will keep losing the enamel very slowly and gradually, because it's the hardest substance known in our body. So, but it does still lose out. So in the elderly people, you see sometimes the teeth really becoming small and flattened, and attrition. So periodontosis or dentine or cementum apposition are microscopic findings. You don't see them. You don't see them otherwise. So for Gustafson's method, you remove the tooth, you cut it into slices, and when it is 1 millimeter thick, you examine it, and then you look for these factors. Now, cutting a tooth is like a task. Even if you have to cut a bone, it is a task. But normally, if you are going to do a microscopic examination, you would decalcify it. You would have a process to make it softer, which would be a longish process. But then these are the findings that you get, which help you to determine the age. So it's used only in the dead. It is used only in the dead, this method. This is what is not specified or written in your books, but because you know that it would require tooth to be taken out, tooth to be sliced, tooth to be examined, and you won't be able to place it back. So you don't do it in the living to estimate their age. You do it only in the dead body where you can do this procedure. So of these, this particular finding that the root becoming more transparent with time, that means losing out on minerals, losing out on calcium. It keeps moving out as we age. So you have transparency of the root increasing with age. The next thing that we move on to is ossification of bones. So there is a lot more to read in eruption of teeth. There is a lot more to read, and as you read what you hear in the class, that will make more sense, and it will apply better to what you read. And as we move to the ossification of bone, ossification of bone is again something which follows a relative trend, but then again it is relative. A relative trend meaning that for how long will my bones continue to grow, their cells will keep proliferating or multiplying, and when will my growth stop? When the ossification of the bone will be complete, I will no longer grow tall and my bones will no longer continue to grow and I am done. So you have a certain trend amongst races, you have a certain trend in geographical areas, and then you have more or less a general trend in the entire human population, right? So you don't, because now we are such a mixed race, we eat more or less all kinds of food depending on our affordabilities or accessibilities, but so you have, when you open some books of forensic, a standard book, not a usual undergraduate book, a standard undergraduate or a standard forensic book would be Modi's book. So when you open the Modi's book, you have a few pages, like 8 to 10 pages with charts. A person having done a study in New Zealand, a person having done a study in UP by the name Nat in 1932, or you have Goldstone having done a study in some population. So there are a table with 7 to 8 study, and then Gray's Anatomy is not included in the Modi's. If you add Gray's Anatomy to it, when does a bone ossify, you will get another picture. So when you look at the bone, you can look at the bone in two ways. If I want to look at your bone, I'll get an X-ray done, right? If I want to look at the bone of a dead body, I will just clean the muscles and I will just collect the bone and have a look. So a bone is examined in two ways. One is bone as such, bone per se, and one as a radiological image, right? Even there it is a variation. So whether a person did a study on the bone or whether they looked at the bone on the X-ray may make a difference, right? So when you are looking at that study which says when does the distal end of radius fuse and stop growing, so you will find that somebody says 14 years, some 15, some 16, some 18, and some will go to 19. So there is so much of variation. So which one would you pick, or which one would you think is correct for your purpose? So we have found over decades that for Madhya Pradesh region, roughly the gallstone standards work. So gallstone standards are something that we use. So the ossification of bones go by a certain table, like when does which bone fuse. So when our long bones are growing and we are growing in height or developing physically, the bone, the shaft of bone, which is diaphysis, the ends is the metaphysis, which is where growth takes place. So the ossification closes at that, and I'll just show you an X-ray to further explain, and it will perhaps make it more clear. So the ossification completes at a particular age. It is seen close to ends of bones. It signifies that the growth is complete. It can be seen on X-rays and on bones. Looking at bones is of course best, because you are looking at the X-ray is what you are looking at a bone where both the surfaces are going to overlap. So you may not be able to really see a gap if there is a gap, which we'll explain to you. But then you have It's easier to do, can be done in living and dead, and it can also be preserved as such, as a plate or a photograph. So it has its advantages. And the standards which we use are the gallstone for the Madhya Pradesh region. They might vary if you move in the country in different parts, or you move to another country, that which standards fit most the population or most of the population. Is this clear, this photograph? So this is the X-ray image of a bone where there are two bones, right? This is the long shaft of the bone, the long shaft of the bone, the ends of the bone, and when the bone forms, they form first by primary ossification centers, and then secondary ossification centers come into existence, and you have this. This is the region where the bone is further going to grow, keep growing. So the shaft or the main length of the bone doesn't grow, it remains like that. What grows are the ends of bones from both sides, and sometimes it stops at one and then continues at one end. So what you may have is bone growing at the ends, and that's how we see the X-ray and find the age. So like this is the X-ray of a hand, and the fingers, and hand X-ray is considered one of the better things to do in a living person, because number one, there is nothing inside the hand which has any soft organ which is multiplying, which may be exposed to radiation and may suffer harm. You can put the hand a little away from the person and say, okay, you hold the hand here and you stay, and the radiation may go a little further from the body of the person. So hand is considered a very good area to examine. Another reason why hand is used is, thankfully, this is like very natural, that while medico-legal importance of 18 years of age is there is importance of 12 years of age, there used to be importance of 16 years of age, which is no longer legally there. So hand is very good to estimate the age around 18 years, around 16, 17, whether a person has crossed or not the age of, and reached the age of majority or not. So if it's a sexual crime, or if it's a homicide, or if it is a crime where you want to assess the person is a major or not, or sometimes we get age estimation cases where a person takes part in some sports activity, and while the person takes part in that sports activity, and the people suspect that the age of the person is not just 15 or 18 or 14, whatever is the prescribed age group. So that case also, they would like to have an assessment of age. If the documents are also being questioned, that these are documents which have been created. So you have a lot of such cases also, which you look at, and hand is very good there. Hand is very handy. So it's something that is done for age estimation. So what you look at here is this is the thumb, and this is index, middle, ring finger, and little finger, right? So this is the radius bone, and this is the ulnar bone, and these are the carpal bones, these are the metacarpal bones, and these are the phalangeal bones, right? We know this. You know this? That this is the radius, ulna, the carpal bones, the metacarpal bones, then the phalanges, and this is thumb, index, middle, ring, and little. Yes? Now we go further into this X-ray, and we look at this distal end of radius. So we have proximal and distal ends. Proximal means which is above, and distal. So distal end would be seen near the wrist. In the distal end, what you see is that this part and this part of radius are separated by a gap, So this gap means that the ossification is not complete. The cells are still multiplying here. This is not yet laid down with calcium, minerals, and closed? No, this is like open for growth, and the growth is happening here. So this person will probably have longer limbs, maybe a centimeter or two more, and so this particular criteria is used by us for age estimation, and we would say that this has not fused. This distal part has not fused with the shaft. So the word we use is not fused, not united. So once this is not united, base of the first metacarpal is looked at, and distal parts of the other metacarpals is looked at. So when we look at these parts and these are not fused, we refer to the chart again. So the chart says, by Goldstone standards, that the base of first metacarpal and the distal ends of other metacarpals fuse between 14 to 17. So we know that this person is not like crossed 17, but this is a big range, right? Then we look up the radius, and ulna is also not fused, although this X-ray is not very clear, but this is also not fused, and this is certainly not fused. So when we look at this radius and ulna, we also would refer to whether this is the X-ray of a male or a female, because most of the studies say that there is a difference of about 1 year in fusion of bones in males and females. So in the females they fuse early, and in the males they fuse a little later. So it is, if it is hand of a female, it would be probably 17 years, less than 17 years, because this fuses at 17 or this fuses at 18. We will refer to the chart, and then we will say, okay, these are not fused, this is also not fused, so the age of the person is 17 or between 16 and 17. Because you can see how many bones which you are assessing, 5, 7 here, 7 bones you are assessing here, right? So whenever you look up that in the court, when they say, how can you be so sure of your age estimation by looking at the bones or ossification, when the book by Modi says that any ossification test will give you the age as plus minus 2 years. So it's written in that chapter that the ossification test, the so-called best test is ossification test, and it gives a difference of plus minus 2 years, which means you will, if you think the age of a person is 15, it would be written as the estimation would be 13 to 17, which is again like no use at all, no use at all. But what we end up doing is, or how we interpret that statement, that statement is when you are looking at a single bone, that estimate is for a single bone. Normally when you do an age estimate, you look at something like 10, 12, 15 bones. You don't look at just one bone. So when you are looking at 15 to 20 bones, if you were going to add iliac crest here, you were going to add ischial tuberosity, the X-ray of the pelvis region. If you were going to look at the fusion of the 3 bones or femur head and humerus and the upper end of radius ulna, if you're going to look at all these, and we normally would look at 8 X-rays from 8 different sites where we would get something like 20 bones from where we would be assessing the age, then it becomes more accurate at a younger age group again. That means below 18, it is very easy to estimate the age by ossification within plus minus 6 months. So we are able to give estimation of age with plus minus 6 months and answer all the questions in the court related to it and verify that the age of the person is this much and would not vary by more than within a year. So that's how the work of age estimation goes on. The secondary sexual characteristics that we look for age estimation includes examining the pubic hair, axillary hair, or looking at menarche or asking about menarche, development of the breasts, development of external genitalia. So physical examination also is added in the younger age group, and this adds to the age estimation criteria, although again these are within a range, but when you put all the ranges together and look at the predominance, you do get an age estimation which is fairly good at younger age groups. So when we do the age estimation, we have a suspected age in mind, that if the age looks like or is suspected to be 10 years, 15 years, 20 years, accordingly we will say whether we would like to do a physical examination or not. If the person is 20 or 30 years, or sometimes they ask us to do an age estimation for a 60-year-old man who's serving his term in prison, and because of good behavior, he's going to be bailed out or is going to be relieved from jail. So they say if the age estimation can be done. So in a 60-year-old, it becomes quite a task, But then there is no point in doing a physical examination, but a clinical examination is done where ophthalmology is of much use to us. How much is the hypermetropia in that person, how much is the astigmatism, and how much is the, by the urologist, by the prostate size. So they have different criteria for advanced stage. So you have age by examination of teeth and by X-ray examination of relevant areas. So the relevant areas are selected based on what age we are suspecting. So if it's a young woman who is a rape victim who might be pregnant, you don't do the pelvic X-ray. That's contraindicated, that you should not do an X-ray of the pelvis region. So it depends on each case which area would become relevant and which area would be avoided or not done. Yes? So if you are having a person where you are suspecting the age to be between 17 to 20 years, one would do wrist joint, and where distal end of radius ulna would be one of the main bones which would be important there, along with the metacarpals and the hip bone where we are looking at iliac crest and ischial tuberosity. So both these bones, both these areas, the iliac crest and ischial tuberosity, as we will show you in your practicals, that iliac crest first appears at 14, then begins to fuse, then completes its fusion by 17. So you have an idea at 14 if it has appeared, if it has fused. If it has not completely fused, if it's male, it will fuse by 18 to 19 years, in a female by 17. Ischial tuberosity in both appears around 16 years and fuses by 20 years. So you have these bones when the suspected age is 17 to 20 years. You also can do medial end of clavicle, which is not written here for some reason. Medial end of clavicle, which is the last bone to fuse in the body, last long bone to fuse in the body, which fuses at around the medial end around 21 years. So one can look at these, so depending on what is the suspected age. So we have the question of accuracy, of how accurate is the age estimation. So while we do the physical in again younger age groups, dental for eruption of teeth, again in younger age group, and radiological examination, the ossification tests for multiple bones, then you have an accuracy of age which comes down to plus minus 6 months. Although as people who do age estimates, we do feel that it's even lesser. We are probably more sure of it to be between plus minus 3 months. We are almost sure that this is the age estimate. If the person's age is less than 18, and we are able to do all these tests and compile them together. This is a photograph of just pubic symphysis. These are the real bones, and if you will look at the year here, it is 1920. So the studies which started in 1920s, like looking at the pubic symphysis of bones, which are remarkable studies, because this particular surface of our pubis bone, if both of them, these are taken out and cut the rest of the bone and the surface is only showing. What started in 1920 as a good study and underwent a lot of modifications is now done by a 3D CT, but the foundations are laid down in 1920. They've been time tested. This is a very good method for advanced stage beyond 20 years. So beyond 20 to 60, 80 years, you can use this method. So now there is a woman anthropologist who, if she is still alive, has done one of the biggest studies on the pubic symphysis bone, and in UK they do use it. In UK there was one lady by name Sue Black, but this lady who did pubic symphysis is another one. Yeah, a lot of women do very good work. So it is currently this particular woman's work is what we study. And the CT scan part is yet developing as to how much or what would you see in a 3D CT to estimate age by pubic symphysis. So one person did their thesis on this recently, and that was a lousy thesis while he presented it. It was like in a conference. It was hilarious, and it was an insult to all these people who have been working since 1920. And this person, yeah, he was from AIIMS Delhi, where they do virtual autopsy, but like very lousy work. So this is what I just wanted to show you, that these are the methods by which we do. And forensic anthropology, or looking at the bones in a forensic or medico-legal way, is another science which I find very intriguing, very nice, and it gives a lot of information about the age, gender, by looking at the bones. We would of course be sharing with you in your practicals how we do it and how it is said, so that you are able to enjoy all your movies, thrillers more, and when you can laugh at the wrong information which is given to you, which is more common than the right. So it is, it might take away some fun also. But this is the pubic symphysis on which even my teacher mentor worked on these pubic symphysis bones. It, again, it is how long, how much you move, how much you walk, how you sit. And in the 1920s and before, when in our country we were not having the, what are they called, the toilet seats, European seat, on which we sit rather than squat, the Indian toilet where we used to squat, that made the pubic symphysis more granular, faster. So it would show the age of an Indian man to be more than that of a British man, because that man was not squatting while going to toilet every day. Or even in the fields, when you are sitting, you don't have a chair and a bench. Indian rural population sometimes, or we as such, we would probably sit on the floor, or we are sitting just in a squatting position. So often you see men while smoking, having chai or something, sitting in that position. So the position or posture made the Indian study a little different from all these studies which were done in the Western world. So it depends a lot on what bones you use, how you live, what you eat, how would you like to feed your bones. So you have a lot of study on this particular thing. This particular bone is very promising for when nothing else works. So it's a very good thing to dwell on. And one can, and here you notice that stage 10 writes 50 plus years old. Again in 1920, when our life expectancy was less than around 60, like in India when we became independent, our life expectancy was 38 years. Then we moved to 52, then we moved to 62. So not many studies would go beyond till, how would you estimate the age of an 80-year-old? Now we would like to do that too. There are so many. How old are they, or how much are, so it is, it's very interesting to look at how we evolve, and that's for today. Thank you so much. We'll talk more on ossification, we'll talk more on age estimation, and we'll talk more on other identification features next time. Thank you. यस राजा, आज मैं टाइम से निकल रही हूँ. वो अटेंडेंस बस ले रहे हैं, फिर उसको बंद कर लेना.